Well, welcome, everyone. I'm John Gant. I'm actually the director of the Office of Lead Hazard Control and Healthy Homes. And it's good to see so many familiar faces and others that I look forward to talking to as we move forward. Some of you may know that I just returned to serve as director of the Office of Healthy Homes. I was on a sabbatical, but I'm honored and thrilled to be part of this group once again, this crusade. Warren Friedman, who many of us know and respect, said something to me. He says, when you get lead in your system, it usually stays for 30 years. So that's exactly what happened here. I left for a while and I'm back, and I consider myself very fortunate to be part of a group that is so committed to eliminating lead poisoning in children. And if you look around the room, you will see some of the nation's leaders that have helped us get to where we are today and are helping us map where we plan to head in the future. So I want to thank everyone here for all of their efforts on this, what I consider to be a very, very heartfelt mission that we all hope to achieve soon. I'd also like to say thank you to my staff for setting this up, and I'll probably leave somebody out, but Michelle, Peter, Warren, Shannon, Tara, Maya, and others, thank you very much. There's a piece of this that you probably understand in the background, but you might not realize how important it is. And I want to give a shout out to all of those that worked on this rule, because it's not easy not only to author something like this, but then to have to jump over all those bureaucratic hurdles as you try and get it synthesized, if you will, within the building, and then, of course, within the greater federal government. But we've done that, and I want to say thank you to everyone that worked on that. The Office of Healthy Homes actually started out 25 years ago. So this is what you call the silver anniversary. I don't know where the lead anniversary is, but this is the silver anniversary. And the office has done some remarkable things. All of you know what the numbers are, and you'll hear from the secretary later when he outlines some of those. But we've made almost 400,000 houses lead safe. And the interesting thing about it is half of that is through our grant program, the other half is through enforcement efforts. So as we discuss this rule later on, I would encourage all of you to kind of look through that particular lens, because there's different ways to go about implementing what we hope to be a very effective rule going forward. We've protected thousands and thousands of young kids. Now, if the numbers are accurate, almost 18,000 young children have been impacted by our grant programs alone. And we've spent a significant lot of money. So the question is, what do we do next? What's our encore? We know that going forward, we have to make the case why this particular program, and especially the lead safe housing rule, works. So I'm very encouraged by this group here, and what I'm looking for is a dialogue. Let us know what works, what we should be aware of, what our education and outreach efforts ought to look like, what our enforcement efforts ought to look like, and we can take that back and kind of massage the rule to ensure that we're going to be as effective as we can. And so we're here today to kind of listen to your insights. And all of you that are out in webcast land, I welcome you too, and I look forward to hearing from you just as well. So the changes to the lead safe housing rule will allow us to gather the information and share that information so that we know what houses may or be part of the problem, may be creating some health hazards for our children and for our families, and allow for us to react a little bit more quickly. So while these changes, are being proposed, let's take a look at it holistically across the board. We know that we have a whole bunch of different HUD programs that are affected by this. The Housing Choice Voucher Program, the multifamily housing programs, the project-based assistance. And I'd like to ask that when you go into the work groups, think through what would be the best way to go ahead and implement this plan, going forward. I've had a chance to meet with Lourdes, and I want to thank her especially for all of her leadership on this issue. She's had and has taken the role of leading PIH in this particular circumstance, and we've made incredible progress, and I want to thank you. But So she's looking for that guidance too. What's the best way for us to train our people? What's the best way for us to target? What's the best way for us to ensure that our inventory, the HUD inventory and then the housing inventory writ large, is as safe as it can be, especially for the scourge of lead? So the rule is an opportunity to model effective interaction, if you will. And so what bridges do we need to build? What are the outreach efforts that we need to prioritize? And then what enforcement and compliance methods would be most effective? That's what we're looking for today. You know, I do want to give a shout out to the CDC. You'll have a chance to listen to Dr. Patrick Brazy here in a minute. But just last week, the CDC came out with a study that does show that HUD units are safer than unassisted units in preventing lead poisoning. And the same study reported that HUD-assisted units were also more protective than those of the middle class in general. That's a heck of a finding. We've always known, or we believed, that the HUD inventory was as good as any and probably better than most. But this is actual evidence that supports that. So what do we do next? We want to ensure that our HUD inventory is pristine, that we're doing everything we can to identify and correct risks. And then we also want to make sure that that effort translates into the greater community, and we're looking outside of the HUD inventory too. There are some special guests that I have the privilege of introducing, and I look forward to doing that. I will introduce both of them at this point, and then they will follow one another. But first, we will hear from Dr. Patrick Brazy, and he's the director of CDC's National Center for Environmental Health and Agency for Toxic Substances and Disease Registry. So, Pat, I know that acronym probably beats anything at HUD, which is hard to do. But he leads CDC's efforts to investigate the relationship between environmental factors and health. His research on the evaluation and control of chemical, biological, and physical factors that can affect health, with a particular concentration on risk and exposure assessment, has resulted in his publishing over 200 peer-reviewed journal articles. You may know him. He's been in this business for a long time. He hails from Johns Hopkins right down the road. So many of you, I look forward to hearing what he has to say. The CDC and EPA have been our partners in this all along the road. We can't do it ourselves. We need internal partners within the building. We need external partners with all of our grantees and those that are helping us, the philanthropies as well as the nonprofits. Secondly, you will hear from another important federal agency partner, and this is Ms. Keisha Reed, who is professionally a civil and environmental engineer, and she's presently the Associate Director of the EPA's Office of Children's Health Protection, which ensures that all EPA actions and programs address the unique vulnerabilities of children. Her work in that office advances EPA's coordination of eliminating threats to children's health by promoting safe chemicals management, community-based programs, rulemaking, policy, enforcement actions, research, and applications of science. It gives me great pleasure at this point in time to introduce to you Dr. Brazy.
Thank you very much. I'm very happy to be here this afternoon. As you heard, I've had a long career in academia. I've been in the federal government now for a little over a year and a half. And in that year and a half, I've been impressed with the quality of work we do at the Centers for Disease Control and the importance of what it means for environmental health across the country. So originally, Dr. Frieden, the director of CDC, had hoped to be here, but unfortunately couldn't make it. He asked me to come in his stead, and he said to please give you his regards. So as we all know, no safe blood lead level in children has been identified. Even low levels of lead in blood has been shown to affect IQ, the ability to pay attention, and academic achievement. As most of you are aware, CDC, HUD, and EPA, as we just heard, and our partners and stakeholders have made incredible progress over the last 30 years in reducing the number of children harmed by lead from the millions to the hundreds of thousands. But we cannot rest on our laurels. The last miles of a marathon are often the hardest. There are still approximately 20 million housing units with deteriorating lead paint in the U.S., and more than 4 million of these dwellings have one or more children living in them. Additionally, the potential threat of lead in drinking water pipes has come to our attention as the situation in Flint has brought the issue of water and lead poisoning to the national forefront. So while the last bit of a marathon may be the hardest, and I can speak from personal experience, having run a marathon, but it was many years ago, as you might imagine, that's the case. But we also know that while the challenges often seem insurmountable, I'm convinced that we can eliminate childhood lead poisoning as a national threat within our lifetimes. But only by coming together in just the kind of coordinated activity that this HUD rule exemplifies. The CDC currently supports 29 states, the District of Columbia, and 5 cities in order to enact primary prevention efforts through building surveillance capacity to target limited resources and to increase the impact. These grantees use surveillance data to identify the highest risk areas and target interventions, including housing rehabilitation, enforcement of housing and health codes, engagement with healthcare systems, public health care providers, and education campaigns related to health contamination through other sources than paint, and other educational public health activities. In each and every one of these cases, we have come to embrace that success only happens when all of these sectors, both government and non-governmental, work together. Our understanding of the levels of lead that pose a significant risk to children's health and development has changed over the recent years. And harmonizing the trigger points where we all choose to take action is a critical step in maximizing the impact of our efforts. At CDC, we have updated over the years the reference value for public health intervention, most recently settling on 5 micrograms per deciliter, the level matched in the new rule. Just as one rule change has the potential to affect the housing and ultimate health outcome in nearly 2 million households where our nation's most vulnerable children live. It also demonstrates that the clerical partnership activities at the federal level that those of us on this stage and in the audience hope to replicate in states and localities across the country, whether it's through sharing health and housing data and environmental information within data information systems like CDC's Public Health Tracking Program, whether it's through improvement in tools and technologies for blood lead testing, whether it's through redoubled efforts of health, housing, and environmental protection staff in localities to achieve the intent of the lead-copper rule to ensure lead-safe drinking water in communities, or through efforts of hospitals to focus on the Affordable Care Act required community health needs assessments and improvement plans, on identifying and addressing lead risk in neighborhoods where our patients live, work, and go to school. We cannot end childhood lead poisoning if we stay in our individual silos. I'm pleased to see that other elements of the new rule that encourage targeting efforts where the at-risk population is most likely to live, and using our limited resources to maximize the effect of conducting risk assessments in other units and multifamily housing units where one unit in that building is undergoing a risk assessment. Today, we celebrate improvements represented by the lead-safe housing rule. I want to challenge us to look past the regulation itself. I believe that the real key to success is a cross-sector work that went into making this regulation a reality. I want to challenge us all to reach across the aisle, building, street, or city. If you work in a housing and you don't know the directors of your local hospitals, reach out to them. If you work in public health and you've never met the staff at the local water treatment plant, go visit them. Many of the colleagues I've worked with over the years in sectors outside of public health have said that telling the public health impact story is what eventually turns the tide. Protecting the health of our potentially most vulnerable populations, such as children, is something that can unite us all. Finally, I'd like to remind us that a rule or regulation can only really succeed when it is effectively carried out. We must walk away from this meeting committed to taking the potential represented in this new rule and work to see that the potential is fulfilled in every city, town, and neighborhood across the country. Thank you very much. Now I'd like to invite Ms. Keisha Reed from the EPA to the podium.
Good afternoon. I'm really happy to be here today. As many of you know, October is Children's Health Month, and I think this meeting on this topic is a great way for us to begin this month. I'm here on behalf of Dr. Ruth Etzel, Director of the Office of Children's Health Protection at EPA, and again, I'm like Patrick, I'm pinch hitting. She is in Alaska. She is working on with our native Alaska villages on children's health issues there. So she regrets that she wasn't able to join you in person, and it really encourages us to do good work in her absence here today. I'm going to be brief. I just wanted to congratulate HUD on the proposed elevated blood level amendment to the lead safe housing rule and all the work they do to protect children and families from lead exposures. This proposal will reduce health impacts from lead exposure because it is forward-thinking and action-oriented, connecting the criteria for investigating high blood levels in young children to CDC's approach, and streamlining the process for future changes is more protective and allows HUD to react quickly to the latest guidance. The amendment also calls for additional investigation and notification when elevated blood lead levels are found. With this information that is gathered, potential exposures in multi-unit housing will be identified. While EPA is using its regulatory and enforcement authority to reduce lead and hazards in water, soil, and in the air, this proposed amendment addressing hazards in the home shows that our impact can be multiplied when federal agencies work together. And I want to take just a minute to discuss a current interagency effort. The President's Task Force on Environmental Health Risk and Safety Risks to Children, which EPA co-chairs with HHS, is currently working on the first ever report describing all federal key programs addressing childhood lead poisoning across the federal government. This report captures the status of efforts in multiple federal agencies on reducing lead exposure in children, and HUD's efforts, including this proposed amendment, are important contributions to this report. This report is intended to invigorate federal collaboration, and it is a step toward renewed collaborative efforts to address lead exposure in children in the United States. It will also provide the basis for development of a new strategy to further reduce childhood lead exposure. Additional progress can be made when our stakeholders are engaged even beyond the federal government. And EPA is currently working with HUD, our regional offices, and other stakeholders to provide healthy homes training focused on children's exposure for our local stakeholders. With all these efforts, we will definitely make strides in reducing lead exposure for children. I look forward to today's discussion to hear how we might be able to work together more productively in the future. And again, I want to congratulate HUD on their work that they've done in the past, this current proposal, and I want to thank everyone for participating in this event. And if we work together, we can make adverse health impacts due to childhood lead exposure a thing of the past. So thank you. Look forward to the discussions.
Thank you. I'm Dr. Warren Friedman, Senior Advisor to the Director, whom you've met, John Gann, in the Office of Lead Hazard Control and Healthy Homes. I'm going to go over some highlights of the proposed rule. And for those of you who read your Federal Register religiously every morning, you opened up the September 1st edition and you saw our proposal there. I would mention that we have the proposal comments due 60 days after September 1st. That works out to be Halloween. So, as I like to say, our trick-or-treat baskets are going to be filled with electronic and mailed comments. So, the summary that I'd like to provide focuses on two areas. The first is the general, the second is the specific. The general is what standard are we using to characterize elevated blood lead levels so that action can be taken. The specific is what happens when a child under age 6 living in HUD-assisted housing is found to have an elevated blood lead level. So, looking at the regulatory definition, as Pat said earlier, we are following CDC's approach. So, this rule would update our criteria for investigating the cause of a high blood lead level in children under 6. And this covers most of the types of HUD-assisted housing. And we are following the CDC criteria. Now, if the rule were enacted on November 1st, let's say we got in no comments, we have had some comments, we expect more, but had we had no comments on October 31st, then we might be able to issue a final rule immediately thereafter. So the blood lead level would be 5 micrograms per deciliter. And that's what we would do in terms of guidance out to our public housing authorities, out to our assisted multifamily owners, and out to the HUD staff who manage those programs. However, over time, CDC has changed the blood level that they recommend in their guidance be used for environmental intervention, for case management, for a variety of things. So we're anticipating that that level will continue to change. In fact, CDC said that they would look at that level, the reference value or the reference range value as it's called, every 4 years. So that was 2012, and so they're working on updating that value even now. So if and when that value changes, HUD wants to keep track, and so we will have an expedited form of keeping track through a notice of public comment, but not having to do rulemaking. So we'll establish that procedure in this rule. That will help keep us on track. Also, in terms of the level that CDC uses and the guidance that CDC issues, in association with a particular blood lead level, they issue a lot of guidance. And one of those things can be at a certain level is the best time for undertaking an environmental intervention in a housing unit or in a full apartment building which has a unit where there's a kid with an elevated blood lead level. And so what we will do is look at that question of when does CDC recommend an environmental intervention be undertaken and use that in going forward with our assisted housing stock. One of the things that we are doing, and Dr. Bricey was kind enough to mention it, is that we're tracking the CDC recommendation that not only the unit where a child with an EBL lives, but also the other units in the building where other children that are under 6 are living. Now, this is in order to balance out our desire to protect kids who are living with the fact that we can only require things of HUD-assisted housing. So if there's an unassisted unit, we can't require anything. We can encourage, and the rule does have wording on our encouraging the housing owners, public or private, to assess those units and control any hazards found. But it's a limitation of that rule based on our statutory authority. We can't go beyond that. Now, in the specific case, as I mentioned, when we get a report, when there is a report of a child with an elevated blood lead, we're going to require that HUD be notified through all the types of assistance that are covered by this amendment. Right now, the public housing is covered, but not the other kinds of assistance. And so this will expand that to have, as John mentioned earlier, not only public housing, but also project-based housing and the housing choice voucher programs. We will get notification at HUD of the elevated blood lead level case. And this, of course, will allow us to monitor the situation. We have, similarly, the type of assessment that is being undertaken is going from a lead risk assessment under the current rule to a full environmental investigation. This includes a risk assessment, but it looks at other forms of possible causes of the elevated blood lead level. And these could be non-housing materials in the child's unit, such as cookware or medicines or cosmetics. Any number of things could be causing it, and the environmental investigation looks carefully at those. Water is also one of the things that can be looked at if there's reason to think, especially if there's knowledge from the local water utility that the water level of lead is high, then we would definitely want that to be part of the environmental investigation. So what we get then is an expansion that we're having a risk assessment expanded to environmental investigation. We're having all the units that have kids under 6 that are assisted covered, and we're able to look at the notification process and have it be more comprehensive. Now, as I mentioned, there are certainly some limitations because no rule can do everything. So one of these situations that we cannot deal with is the case of 0-bedroom units. These are studio apartments, and there are some other terms. Well, the lead statute that sets up HUD's lead programs and also EPA's lead programs explicitly excluded 0-bedroom units. So we can't require anything of 0-bedroom units for this rule because that was in the underlying legislation. Similarly, we are not in this rule addressing any of the requirements for evaluating housing under normal routine housing assistance when money is to be given to a family or given to a housing owner, public or private, to support the housing that the family is going to be using. This is just focused on elevated blood lead. So there are any number of topics that are of interest, but they're not part of this rulemaking. So I want to end with those brief comments, introduce Lourdes Castro Ramirez, who is the Principal Deputy Assistant Secretary for Public and Indian Housing. She has about 1,300 professional staff in PIH who are managing over 4,000 public housing agencies and over 560 Indian housing agencies. Now, as part of this, they have about 2 million units of housing choice voucher assistance and over 1 million units of public housing. And within those, there are some of the housing is pre-1978, and some of those have families with children under age 6. Well, there are nearly 400,000 children under age 6 in pre-78 public and housing choice voucher units. That's a lot. So lead is always a matter of interest to her. So based on that, I'm very pleased to introduce someone who is, as you are, very interested in the lead safety issue, Lourdes Castro Ramirez.
Thank you so much, Warren. And they're bringing up a chair because I was looking at, there were only 3 chairs. We have 3 panel members, and I was not going to stand for 30 minutes. So thank you. Thank you, everyone. Thank you, Warren, for the presentation. And, of course, to my colleague, John Gant, and the entire Office of Lead Hazard Control and Healthy Homes. Thank you so much for your effort and for bringing us together. To my colleagues in EPA and CDC, very much appreciate the solid partnership that's in place to ensure that the residents and the families that we serve are able to enjoy a healthy housing and community environment. As mentioned, I have the distinct honor of leading the Office of Public and Indian Housing. I'm Lourdes Castro Ramirez, and to my team in the Office of Public and Indian Housing, and also to my colleagues in the Office of the Secretary, thank you all for your work on ensuring that health and housing is a priority, as our Secretary reminds us every single day as we carry out our work. As Warren mentioned, we have the responsibility of providing affordable housing to about 3.3 million households across the country. And we do that through two major programs, through our public housing program and also through our Housing Choice Voucher Assistance Program. And of course, we don't do this alone. This really requires a partnership at the local level, working very closely with public housing agencies and a number of local community partners to ensure that families have access to affordable, safe housing. And so today, it's my pleasure to serve as the moderator. You will have an opportunity to meet several distinguished panel members who have expertise and background in healthy living environments. And it's really an opportunity, as John mentioned, for us to hear about what is working, for us to listen to their insights, and from the perspective of HUD, and through this process of developing the rule, it's really important for us to figure out, once the rule is in place, how are we going to ensure that it's implemented in a way that ensures that at the end of the day, the families and the children that are going to benefit from this are also properly informed and made aware of these changes. So thank you all very much for your presence here, and of course, thank you to our panel members. This is also one of several convenings that HUD has held throughout the year to focus on the importance of creating healthy homes and healthy communities. In fact, earlier in the year, we met at the White House. I think several of you that are in the room were there to introduce HUD's proposal to implement a smoke-free rule for public housing. Much like today, we brought health and housing experts together to learn about the dangers of secondhand smoke and to understand the resources that are necessary and needed by housing providers to implement smoke-free policies within the communities that they serve. Even without the rule, currently we have well over 600 public housing authorities who have already voluntarily implemented smoke-free policies. And we've learned a great deal from them, both in terms of their community engagement process and also in terms of how they've implemented the policies and the partnerships that have been developed at the local level. We hope to have the public housing smoke-free rule here soon. We are continuing to work on that. And as we get to publishing this final rule, again, similar to the proposed lead rule, in order for us to be successful, it's really going to require partnerships and your continued engagement. So I invite you all to continue to be involved and engaged, not just at the federal level, but in your own communities. So just as the health effects of smoking exposure can be prevented with appropriate steps, HUD has proposed the Let's Save Housing rule to align with the administration's interagency effort to address the health of families, specifically the health of the children that we're serving. And as Warren mentioned, HUD's proposed Let's Save Housing rule would lower the department threshold for lead in a child's blood to match that the CDC is recommending. And also it would enable us to continue to make the adjustment as CDC adjusts their levels. These changes will provide faster responses when a child under the age of 6 is exposed to lead-based paint hazards. And as mentioned, this is really an interagency effort. We're working across agencies. As we all know, to be able to tackle this, it really requires a strong set of partnerships. So we're working together with partners in the housing space, in education, and also in public health sectors to continue the conversation, to develop immediate and cost-effective measures that will improve the lives of those that are affected by lead poisoning. So as part of the conversation today, I have, as I mentioned, the honor of moderating this panel. Today, the panel will provide different perspectives on the proposed rule, which is open, again, for public comment. As mentioned by Warren, public comments are due on October the 31st, which is Halloween. So that's a good reminder, Halloween, the 31st. We do want to hear from you. Please, take a look at it. I think today's conversation will also give you an opportunity to come up with questions or recommendations that you think are important for us to consider. So, I'm going to go ahead now and ask maybe the panel members to come up to the stage. And as they make their way up, I will share with you that after the presentations, we will have an opportunity to take questions from the audience. I will be moderating that portion. And I just ask that if you are wanting to ask a question, that you get in line at the mic and also keep your question short, please. Thank you. All right. So let me go ahead and start with the introduction of our three panel members. First of all, thank you all for being here. It's a pleasure to see you all. To my left, let me start off by introducing Dr. David Jacobs. Dr. Jacobs is the chief scientist at the National Center for Healthy Housing, and is one of our nation's foremost authorities on childhood lead poisoning prevention. He was appointed by President Clinton in 2000 to a task force focused on eliminating childhood lead poisoning. His current work includes research on asthma, international healthy housing guidelines, lead poisoning prevention, and green sustainable building design. Please give Dr. Jacobs a warm welcome. Our second panelist is one of the nation's leading experts on healthy housing, Ruth Ann Norden. Ruth Ann, it's always a pleasure to see you, and thank you for joining us today. Ruth Ann serves as the president and CEO of the Green and Healthy Homes Initiative, a national nonprofit dedicated to the elimination of childhood lead poisoning and to the creation of healthy, safe, and energy-efficient housing for America's children. She also serves as a federally appointed liaison to the CDC Advisory Committee on Childhood Lead Poisoning Prevention. Again, Ruth Ann, welcome. Let's give her an applause. And then finally, our third panel member is Georgie Bana. He is the Director of Policy and Program Development at the National Association of Housing and Redevelopment Officials, also known as NARO. Thank you, Georgie, for joining us today. NARO is an affordable housing association with about 17,000 members representing about 2,800 housing providers. Mr. Bana has worked with low-income communities for over 15 years. And in his current position, he conducts policy analysis, formulates regulatory recommendations, and interacts with HUD on behalf of NARO members. And I can attest to that. I see him quite often. So with that, let's give him also an applause. With that, we're going to go ahead and turn it over to Dr. Jacobs to begin today's conversation. Thank you.
Okay, thank you. It's a pleasure to be with you this afternoon. First, I should open by congratulating HUD for getting this rule out. I understand it was a priority, which is not a simple thing to accomplish at the end of an administration. So congratulations for doing that. I would note, I hadn't realized this was the 25th anniversary of the lead office at HUD. It's probably worth, I've toured a couple of lead mines in my years, and it's worth noting that lead is often co-located with silver deposits, so it's fitting. A factoid for the day. What's that? You don't look that old. Oh, I'm graying. I won't go there. So I think what you heard so far today is a re-energized new collaboration between public health and the housing world. And that's something that I think the nation has struggled with over the years. We have our own different spheres of interest and our own jargon, and so bridging that divide has been a task. So the idea that HUD would finally use sort of medical data, such as an elevated blood lead, is timely. Where we have to get, though, is eventually use our ability to track children, which we do a reasonably decent job of with elevated blood leads, but also begin to think about tracking houses. It's not good enough to just react after kids have reached a certain blood lead level. We have to prevent those exposures. That was, in fact, the mandate that Congress established in Title X way back in 1992, but it's still, frankly, a vision that requires more collaboration and more effort. I would note that sort of one of the unique features of this proposed rule is that it actually provides for a new sort of investigation. It's not really new. I remember when I helped author the HUD guidelines way back in 1995, we worked with CDC to develop a protocol to investigate homes of children with elevated blood leads. But in point of fact, that protocol really wasn't implemented, and this rule promises to do that. Now, that's sort of the good news. I think that's valuable. We should be looking at holistically at many sources, not just housing-only sources, which is what a risk assessment would do. But the downside, and something to think about for the conversation here is, and I take partial blame for this, we have a lot of different ways of identifying hazards, don't we? We have a risk assessment, we have a lead inspection, we have a screen, we have a visual assessment, we have a presumption of lead paint. And now we have this elevated blood lead investigation. So that's 6 different methods, and there's probably some more. Now, there's good reasons for each one of those. But if you step back for a moment, maybe we've made it too complicated. Maybe there's a way to think about how to streamline that so we get at where we want to go to really identify the sources. Some specific thoughts that I have with regard to how to maybe think about strengthening the amended rule. And again, I think it goes a long ways in where we need to go. But there's sort of general language in there about HUD encouraging what's called a designated entity or responsible party to do certain things to protect kids. And that's nice, but why not actually have explicit authorization so that, for example, public housing authorities can use their admin fees to deal with the cost of investigating elevated blood leads or other funding sources? How about Section 8 owners being allowed to use maybe some of their subsidies, or I guess it's housing choice vouchers, I'm showing my age, to look at how we might make those homes safe for children. The rule currently allows so-called interim controls in cases of children who are blood lead, or who are poisoned, or have elevated blood leads, I should say. And interim controls certainly have been shown to be effective. However, in the case of a unit where we have some evidence that there's been inadequate maintenance, interim controls probably are not the proper thing. We ought to think about whether we should require abatement. That is a much more permanent fix that doesn't have such great reliance on maintenance to make sure that children's blood lead levels don't continue to rise. You can't see lead, right? So a visual assessment, and that's part of this rule for other units in multifamily buildings. It only requires, in some cases, a visual assessment. Why not use the analytical tools that we have, like dust testing, like XRF paint X-ray fluorescence paint measurement, and those things. I think the visual assessment goes a certain way. It identifies deteriorated paint, but it can't really identify lead problems. With regard to implementation, there's always a debate about this. The CDC guidance and the HUD guidance that went along with it, they've been out for years now. So my sense is we don't need to wait another year or 6 months even. 3 months should be an adequate implementation period. We do know that people will need to be trained. My sense is that people may not fully understand how a risk assessment differs from this elevated blood lead investigation. So I think there will be a need for some training on that regard. And then I think one area for further study is basically the CDC reference value wasn't really intended to be a case definition. It's the 97.5th percentile of the blood lead distribution. So maybe something to charge the National Academy of Sciences or others with is to think through, how are we using a case definition versus a reference value? Are they the same thing or should they be different? And then finally, I want to mention 2 things that are sort of ongoing. Many of us know that HUD and other federal agencies like CDC do not have the necessary resources to really conquer this problem. So there's a major campaign going on. Ruth Ann and I and others are working on this through the Coalition for Lead and Safe and Healthy Housing, Find It, Fix It funded campaign to basically look at what will it take to address this problem once and for all. Lead is in the nation's spotlight, isn't it? And so it seems to me that we ought to do what we need to do to make sure that we finally put some bones on, or meat on the bones to actually eliminate this problem once and for all. On December 5th, there will be a lead summit meeting here in DC. You'll be hearing more about that, but the hope is that right after the election, we'll be able to create the political and necessary will from not only the existing lead voices, but many new voices to basically make sure that the next administration, whoever it may be, actually does the right thing and protects our children. So there's a lot there. I look forward to the conversation later on today. So thank you.
Thank you, and those are great remarks, Dave. We are very proud of and fortunate to be co-chairing, along with Mount Sinai and the Blue-Green Alliance, the summit on December 5th. It is something that I think is critically important that we pay attention to as a fulcrum event as we move forward. And I know the National League of Cities and others are doing convenings around this issue. But Lourdes and John, thank you very much for not only highlighting this day on the lead-safe housing rule and the efforts that it takes to move within a year, what I think is critically important, and that is an important step in ending the toxic legacy of childhood lead poisoning in this country. And while the lead-safe housing rule brings us into compliance with the threshold levels of the CDC, the other part of the guidance from that CDC movement was to put into the public record, into the public consciousness, the mandate to understand that there is no safe level of lead, that what we must do is not, as Dave indicated, track children, but we must be committed to eradicating and ending the issue of childhood lead poisoning. So we have to use this as an opportunity to build a strong education campaign with property owners, with governments at the state and local level, as well as the federal level, that we have to build in the cross-sector entities that are so engaged and pay the price if we do not advance lead poisoning prevention. There is no greater moral case than protecting the neurological development, the educational outcomes, and the long-term health and productivity than there is behind the issue of lead poisoning. But there is also the business case. We know from HUD's own studies that for every dollar invested in childhood lead poisoning prevention, we will get, at a minimum, a $17 return up to over a $200 return to the taxpayer. But what we do get, more importantly, is the child who will compete in the third grade level reading levels that they need to attain. A child who will better graduate from school because kids poisoned by lead are 7 times more likely to drop out of school. They're 6 times more likely to be engaged in the juvenile justice system. These are costs that no child, no family, and no community should bear. Now, I really want to congratulate and point out the recent study that came out from CDC showing the good work of public housing over the years to actually be more protective of children that have a better outcome. But here we have in publicly supported housing and through programs throughout the country that we need to spread what we know about primary prevention. And that means what we are learning here by advancing the lead-safe housing rule, what we know from decades of work around primary prevention, should be mandated at every federal agency. When there is a federal dollar invested in housing intervention, there should be no question than the removal of lead hazards. Let's start by replacing every leaded window in America and stop having kids poisoned by the tiniest amount of lead dust, the equivalent of 3 granules of sugar that poison kids. cross-collaboration with educational funders who want to see outcomes in schools and in graduation rates and long-term productivity. Every education dollar, every child development dollar, and every housing intervention dollar should be focused on the achievable goal of ending lead poisoning. We have finite resources. We have to use the cross-sector collaboration. We have to use the education that we have here in training public housing residents, in training landlords who are using housing choice voucher programs, in ensuring that we go beyond housing quality standards to lead prevention standards. We, in fact, in our organization run one of the only, it may be the only, or one of the few housing choice voucher programs that is dedicated to address the issue of childhood lead poisoning, and I appreciate the City of Baltimore for having the vision to do that, and in entering a new agreement with the Green and Healthy Homes Initiative to create one of the nation's first health-based housing authorities as we advance lead poisoning prevention, asthma reduction, and environmental health improvements. We have to find ways to incentivize property owners through education and through enforcement standards. I come from a state where we set higher standards on lead prevention in privately owned housing, and we have achieved through that, through private investment, a 98% reduction in childhood lead poisoning. So standards matter. You're helping to set the tone with standards here that will move to the private markets, and it's critically important. We have to train our state and local leaders on what we're doing here and how to advance this in their own community through all of their housing stock so that they're not paralyzed by the issue of lead poisoning, but see it as an opportunity to improve their communities and build capacity to achieve that. And we want to make sure that as we look forward and give comments on the rule, we would really love to see the expansion of looking at whole buildings and whole properties when we have a child who is poisoned, to ensure that we don't just look at that one unit, but take the opportunity to be preventive in the scope of what we're doing. And I know that there are some constraints in how we have to do that, but I think the failure of us in doing that may leave another child doomed to the outcomes of lead. And we want to make sure that as we expand this environmental investigation, which I think is a great complement to be looking at this, that we're using that opportunity to educate the residents on the risks of lead that come from the multiple sources. We have seen this year in the public consciousness the role of lead in water, lead in soil, and other exposure pathways in ensuring that we use this as an opportunity for public engagement, public education. And that includes contractors and workers in the fields that are doing property maintenance and working, that we expand what I see as the new face of healthcare, which are housing contractors in America, to make kids healthier and to improve the efforts. And as we modernize these standards and we begin to be preventive, let's also ensure that we're looking at legislative support for HUD to take actions that we can advance this work where necessary, and that we continue to level the playing field for every child through primary prevention. Lastly, one other comment is we are strongly in support that we get these properties that are going to fall under the rule in compliance within 90 days. And that we move to ensure that we have that happen. Ataturk changed Turkey from the Arabic alphabet to the Western alphabet in 1923 in 90 days. We surely can get all of the housing stock in compliance and public housing in compliance within 90 days. So let me stop there and turn this over to our partner here.
Thank you, Ruth Ann. Again, thank you, lawyers. Thank you, panel. On behalf of the National Association of Housing and Redevelopment Officials, NARO, I appreciate the opportunity to discuss this very important and timely issue of lead-safe housing. As a little background, NARO was formed in 1933, represents about 20,000 individual agency members. Collectively, that means our membership manages about 970,000 public housing units, about 83% of the public housing stock, and about 1.7 million housing choice vouchers. So many of NARO's members also are involved in the administration of federal funds through the community planning and development programs. So NARO works to support these policies and promote and provide local discretion and flexibility to housing authorities so they may best meet the needs of their local communities. For housing authorities, lead hazard reduction is important. As a minimal goal, again, HUD has set, and all PHAs must meet decent, safe, sanitary housing and good repair. But that's a minimum standard. Housing authorities are working with their federal, state, and local partners work tirelessly to provide that standard and above. The joint HUD CDC study that's been mentioned before showed a significant difference in that blood level between a child living in federally supported housing and similar children of low-income families in housing where there is no federal assistance. So when you're taking into account the demographics, the socioeconomic and family characteristics, there's children in the federally supported families have approximately 20% lower blood levels on average than children and families not receiving federal assistance. The PHAs are on the front lines of protecting children from lead and its damaging effects. PHAs understand the importance of eradicating elevated blood lead levels and aligning the HUD's elevated blood lead level thresholds to that of the CDC. The streamlining of the terminology and the blood lead level measurements is a common sense and logical step. But partnerships are the key to the continued battle to reduce and eliminate elevated blood lead levels. PHAs must work closely with everyone at the table when dealing with lead. They must also bring new partners to the table. The Office of Lead Hazard Control in Healthy Homes has been a primary partner providing this guidance and a roadmap. Local health departments are also an important partner, not only identifying cases of elevated blood levels, but also in the education process for both the PHA and the families that the PHA serve concerning the hazard of elevated blood lead levels. And speaking of education, this is an area where additional and new partnerships can be had. Many of the children that PHA serves spend large amounts of time in early education programs, Head Start, even daycare programs. And then they continue on as they head off into kindergarten, or as my kindergartner likes to call it, big girl school. So our children's educators are important links to educating parents and of the consequences of lead and the additional sources of exposure. All of us as stakeholders need to reach out and strengthen the ties we have with education partners to ensure that our children are learning in lead-free education environments. As partners and stakeholders, it is important that we keep the open lines of communication so a reasonable process can be implemented to reach the goal we all share. The Lead-Safe Housing Proposed Rule has a laudable goal shared of reducing and eliminating elevated blood lead levels. All of us would love for this to be HUD's most irrelevant and rule and never have to implement it because elevated blood lead levels don't exist any longer. And we are not getting those knocks at the door, phone calls from a scared parent to discuss a blood test. Hopefully soon that will be reality, but not today. So we can strengthen our partnerships and streamline the process. I would like to share some of the thoughts that we have heard from our members concerning the Lead-Safe Housing Proposed Rule. Again, aligning the HUD Lead-Safe Housing Rule to the CDC's elevated blood level reference range level is a logical streamlining decision to put all the partners on the same page. The concern is that the CDC does plan to update the trigger reference range every 4 years, and their last guidance in 2012, which means they're currently reviewing that level as we speak. It would make sense to coordinate that CDC trigger reference range update to release and implement the lead-safe housing rule. This would eliminate any confusion that may occur if HUD implements the rule before the CDC updates that guidance. Housing authorities also appreciate HUD asking for input on the overall implementation timeline of the lead-safe housing final rule. Currently, proposed rule is considering an effective date of 6 months after publication of the final rule. However, depending on how the comments come in, HUD may look at implementation period of either 1 year or 1 month. Although this rulemaking would affect only a small fraction of housing covered by the whole lead-safe housing rule, its impacts on the group are significant. The threshold change from a fixed 20 micrograms per deciliter to a current CDC trigger reference range of 5 micrograms per deciliter will be significant for housing authorities. Their understanding of the implications, requirements, and compliance of this proposed rule will take some time. It's important that PHAs have enough time to implement the rule correctly, just as HUD has taken the time to form a reasonable rule. An implementation period of a year would provide PHAs and affordable housing providers a manageable period of time to coordinate with its partners and also to use the very limited resources that it has. There are also just been discussion of the lead hazard control activity schedule. The schedule proposes a lot of things that needs to be done for housing authorities within the first 30 days. 5 days to notify the field office and HUD headquarters, 15 days to start to complete the environmental investigation on the index unit, 30 days to complete the risk assessments on the other units in the building, 30 days to complete the interim controls after the index unit report has come in, and then 30 days to complete the lead hazard controls on the other units as well after the risk assessment report. The requirement and the complexity of performing these lead hazard controls in such a short amount of time during the limited financial support will be significantly burdensome on PHAs. So particularly in the initial implementation, as PHAs need to address a substantial and one-time increase in children with elevated blood lead levels. The proposed timelines are especially problematic for small PHAs which may have limited staff which would not have the funding and resources to fill these tasks. Additionally, it may be challenging to find lead abatement specialists that would be available to come to the development frequently enough to meet this deadline, especially in smaller rural communities. One last concern we've been hearing as well is on lead-safe housing rule doesn't specifically address public housing units going under the RAD process, the rental assistance demonstration. Those RAD redevelopment units should be given the flexibility with lead abatement timelines, as it would be a wasteful use of very limited resources for PHAs to undertake capital improvements on projects that are going to be currently under schedule for redevelopment. So units undergoing RAD that are not being redeveloped, though, can and should be required to comply with the rule. Limited resources was a theme that touched on each of the areas I just mentioned. We encourage HUD to request and Congress to appropriate the necessary and adequate funding to allow PHAs and affordable housing providers to be quick, responsive, and comprehensive in addressing not only the hazards, but also the significant and substantial backlog of capital improvements needed throughout public housing. Lead-safe housing rule comments, as Warren and Lourdes mentioned, are due on October 31st, and we encourage all stakeholders and partners to submit comments so that the final rule will be the best possible rule. NARA will be providing the detailed comments, and again, we encourage everyone to provide comments. Reasonable lead-safe housing rule will streamline lead reduction process and provide a solid base for continued and growing partnerships. PHAs and affordable housing providers are the boots on the ground taking on lead hazards, and they look forward to being eager and active partners with all the stakeholders and everyone in this room. Thank you.
Thank you very much to the three of you. And as you heard from the panel members, great feedback, diverse set of recommendations. And really, this is an opportunity for us as HUD to listen to diverse perspectives, recommendations based on the area of expertise and experience that each panel member comes from. So now, this is an opportunity for us to open up the conversation to those of you that have joined us here in person. We have a microphone, and I would invite you to come up, and if you have any questions for any of our panel members. I also know that we have a number of people that are viewing this online. I'm not sure if we're going to be able to take online questions, so it looks like we're not. So that's more pressure on those of you that are in the audience. So who wants to go first? This is not a shy group, right? Sunia Saterman from the Council of Large Public Housing Authorities. Thank you, Sunia, for being here.
Well, thank you for having this event and HUD's attention to this issue and the cross-sector focus. We think that's absolutely critical. I'm Sonia Zaderman, and I'm the Executive Director of the Council of Large Public Housing Authorities. Thank you. We represent about 70 of the largest housing authorities in the country. They collectively operate about half of the public housing and about a third of the voucher programs. These cross-sector relationships are something that we're very invested in. We're working on building partnerships with education sector and health sector through the generous support of the Gates, Kresge, and MacArthur Foundations. My question is really around the resource issues. I think philanthropies are beginning to get invested. We see federal level government and other community stakeholders invested, but we really do not have the resources to address this, and I think, excuse me, Georgie did a great job of highlighting it. We currently get about $2 billion a year in capital funding, which is really the only source of capital improvements in public housing. That reflects about half of the annual need of capital investment, and that does not even touch the $26 billion backlog. I would ask, in terms of the administration's view on this and the fact that we're now beginning to align EPA and CDC and HUD, whether we can see the comparable investment in resources to get the job done, which means the whole building, the whole development issue, I think, in a preventative strategy is absolutely critical. But we need those resources, and it would be very important to see that addressed, both in the administration's budget. If this is going to be a high priority, it should be reflected in the administration's budget, as well as what Congress does. I guess my question is also, where are there other resources in the system that we can marshal to be focused on this problem?
Thank you.
So
Ruth Ann?
I want to take that a little bit, and I do want to point out that there is great leadership in philanthropy, but like philanthropy and HUD alone, they certainly cannot address this issue. And so I do think this, first of all, we need to look at the healthcare system and the role of moving Medicaid from paying after the fact on costs for children to how do they become an investor in wellness. New Medicaid regulations are allowing state Medicaid programs to invest in community issues that can lower illnesses. Lead poisoning is one of those. Maryland has a pilot program right now utilizing state Medicaid to look at how it can become an investor in primary prevention. So that's one. Hospital community benefit programs, the IRS allows for the investment by hospitals into community and into the built environment to address how do we build better, healthier housing. There is no healthier housing if you have lead hazard, certainly. So that is an opportunity where we can engage healthcare. We have to engage education funders, whether they're the Gates of the world or the Annie Casey's of the world, or whether they are the U.S. Department of Education, and how we are looking at outcomes on grade level reading, on graduation rates. And this is our call. So we have a strategic plan, a blueprint for action, Green and Healthy Homes, published this year, that calls for $2 billion a year investment just through to address the 3.6 million houses that we know have imminent hazards. But we have to have in our housing standard, our housing investment standard in the U.S., in our federal agencies, the standard of lead hazard control and the resources to go through it. So Congress has to join us in this, if I'm allowed to say that, in this arena. But it is also imperative of governors and of mayors to understand that if you want to have neighborhood stabilization, if you want to have better outcomes in school, and you want to lower crime, this is something that the Wall Street Journal and Mother Jones, two publications who couldn't be further apart from each other in April of 2013, agreed on. The business case is so clear, so loud, and so compelling that we have to make the choice to do this. But if we're able to align and braid and coordinate resources that already address housing, we know by doing that we save a significant amount of money to line them together, and that we can reinvest those resources in lead hazard control and eliminate this issue in 5 years.
Just very briefly, because I know there's a lot of questions. I would point out that the President's Task Force report in 2000, while I'm all in favor of bringing philanthropy to the pet table, I think there's a definite role for them. That report had an interagency budget request. You know, which agency is going to do what and how much does it take to deal with that? We don't have a plan like that anymore. That was a 10-year plan. The nation needs that. So we need to have a new goal and a new strategy with the money to make it really happen. I think you're exactly right. Everybody knows HUD doesn't have the resources it needs. not just for lead, but across the board. You know that probably better than I do. So the time has come to make the investment in our housing stock and in our people instead of just paying the bill at the back end. We pay for, as you said, we pay for this problem anyway. So what's the smart way to pay for it? You pay to prevent it. You don't pay to fix the problem maybe after the fact. So,
Georgie, did you want to chime in?
Just briefly,
Yes.
I think the partnership's definitely going to be very important, but also it's just not a lead problem as well. There's other capital improvement needs that are needed out there, even environmental, mold, radon, other issues that need to be focused on. And it's, as a holistic approach for the entire unit, going in and just taking care of lead may not solve all the other problems as well with those units. So needing the funding, full funding that's needed to attack the entire unit and entire buildings that need the help.
Great. Thank you. To our next question.
My name is Neil Hodges. I'm from Cleveland, Ohio. I manage a health initiative that's funded by the Cleveland Foundation. It's anchored by Case and University Hospitals and Cleveland Clinic. And it's co-managed with me and my partner, Jackie Matlube, who's a research associate at Case. I think we're sort of doing what you're talking about, and I thank you for your comments and your remarks. We are looking at a community that surrounds University Circle. And if you're familiar with Cleveland, that's a area that's in Cleveland that houses Case, Western Reserve, Cleveland Clinic, University Hospitals, the Museum of Art. Is world-class health, is world-class art, is world-class education, but the surrounding communities is a tale of two different cities. As I was sitting there listening to you, I thought about Freddie Gray, the young man who lost his life in Baltimore, and in an indirect sort of way led to his demise. The third grade that you talked about, the reading scores that creates the pipeline to prison, if one, especially boys that are black and brown who don't have the chance. I have a bevy of questions from my colleagues that I won't ask all of them, but at our table, we have community and institution alike. I'm community and Jackie is institution, and we have created what's called CHESS. They are community health action teams. We deal with infant mortality and lead. At the base of our conversations is racism, because most times people don't talk about it, but at the base of all of these health initiatives or health disparities, that's part of it. And I think what we've been doing is having a tough conversation at the forefront as we move into this third year. The first year was it was a qualitative study. Second year implementation. This year we were funded by the Cleveland Foundation. Again, I can ask a bevy of questions. I'm going to just ask one as it deals with a rental registry. And the question is, how are other cities using the rental registry to provide sustained funding for proactive inspections and enforcing maintenance certificates with landlords? Thank you.
Thank you. Thank you for your question.
I'm happy to, first of all, I want to really praise our partner at Green and Healthy Homes, the Cleveland Foundation, for the program that is unfolding is great. But I think this issue of racial equality is at the heart of what we have to think about in the issue of lead poisoning. It has damaged and undermined and taken away the trajectory of young African Americans and children living in lower income communities for far too long, and it is a call to action. As you know, I live in Baltimore, and Freddie Gray's level of a 37 by the time he was 3 and moved 4 times really hurt him in his ability to finish school. It was coupled with asthma because he was living in the thing that is undermining the progress for all of our children in this country on an equitable path of opportunity, and that is housing condition. And so I appreciate your remarks on that. Cities like St. Louis have utilized putting fees on building permits and creating funds. States like Maryland have created rental registries and have ensured that we are inspecting all pre-78 housing and getting resources into those programs. There are a myriad of best practices around the country that I would be happy to share with you from the collaborative work that we do at GHHI, and Cleveland is one of those cities, to address that for sure. So I'm happy to cut this short and say that I'd be more than happy to share those resources with you.
Anyone else would like to respond to that?
I just second the sort of the environmental racism component to that. And Amanda Reddy and I just published an editorial in City Limits, I think it is, on the co-location we have of housing hazards and racial and ethnic disparities. So it's very much to the point. It's something, I think it's a voice that's been missing in the lead poisoning prevention community. It is a civil rights issue in some ways. So why not, we need to have more voices if we're really to make progress on this. I think you're exactly right. I also want to applaud Cleveland. Cleveland, in fact, helped us to launch the Healthy Homes effort way back in 1999 out of a tragedy having to do with mold exposure. So it's great to have Cleveland back at the table, and I'd like to learn more about what you're doing there.
Great, thank you. Thank you. To the next question.
There we go. My name's Tom Neltner. I'm the Chemicals Policy Director with the Environmental Defense Fund. Again, I appreciate HUD having this event. I appreciate HUD issuing or proposing this rule and moving that process forward. I also appreciate the great comments from the panel and the good questions. Those are important, especially on the equity issues. My concern is that this rule is not a lead poisoning prevention rule. It is a lead poisoning reaction rule, and we need to prevent it. And I see it as a positive step to do what CDC started in 2012. It's been 4 years. We've got to get moving faster on the next revision to this rule. There are 3 major lost opportunities. One is, on housing choice vouchers, the idea of a visual control is not backed up by the science. It's too easy when you move in for the landlord to put a nice coat of paint, take care of the deteriorated one, and leave lead hazards behind because they didn't use lead-safe work practices. Those lead hazards are what's going to poison the kids. Let's prevent that. We need a risk assessment. The second one is the rule isn't well integrated with EPA's renovation, repair, and residential renovation, repair, and painting rule, the RRP rule. There's weaknesses in that rule, but the more connection you make between it, the better off you're going to get compliance with both. It seems like a lost opportunity to take care of this rule that was adopted in 2008 and went into effect in 2010. So we've lost another opportunity. The other one is, you've talked about lead service lines and lead and water. And I understand that this rule is limited to lead-based paint because Congress has limited to lead-based paint because they thought water was taken care of. We now know better. But it's a lost opportunity to fairly communicate to the resident that there are lead hazards left behind. If these homes have lead service lines, when that line gets disturbed, when the ground gets shaken, you're gonna have lead particulate in the people's drinking water. And to have a lead hazard control program that suggests it's lead safe, or to have a lead safe rule that ignores the water and doesn't communicate it to the resident is misleading. The other aspect is we need to recognize that this rule is in the broader context of housing quality standards and the Uniform Physical Condition Standards, none of which deal with lead particularly well. It could do better, and there's an opportunity on the water side because they don't pay attention to the water side. And I understand that water was not recognized as a significant hazard, but we now know it. So let's fix those rules, especially in the Uniform Physical Condition Standards voucher program, so that we're looking at the right things, the hazards that we know, and we can do real lead poisoning prevention. Thank you.
Yes, thank you for your thoughtful comments. This is also an opportunity, of course, as you all know, for us to hear directly about suggestions that the department should be exploring to strengthen our work in creating healthy homes and healthy environments. I'd like to invite maybe the panel members if they have any thoughts or responses and to the questions and to the 3 recommendations that were outlined.
I would just mention about, I think, the inspection protocols for public housing, for the Housing Choice Voucher Program. Again, housing authorities want to go out, are doing those inspections, particularly of public housing, and they're touching all those units every year. With the next step to actually remediate the lead, to do the lead reduction, resources are going to be needed. And our housing authorities are reaching out to partners, looking for the philanthropy, other partners to help in those situations, but there also needs to be that the capital fund funding needs to be there to be able to holistically take care of particularly the public housing to make sure address those issues.
Amen, Tom Neltner. Thank you, because I don't think anyone here should be fooled that this is prevention. Prevention doesn't happen by detecting children after they're poisoned and reacting to it, and I understand the constraints of the rule, and it is great progress in doing that. But any time in any unfolding of this rule or any action, certainly where we are finding a child's been poisoned, we're too late. But anywhere that we know where there's a unit of any kind of lead exposure, ingress into that unit, we should live by the rule of no safe level. You wouldn't want your 5-year-old to be exposed, and we wouldn't want it. We would not, no one here, and I think our hair would be on fire if it was anyone in our family to do that. So I think this is incredibly important. I would take this opportunity to say one of the things we've been advocating for, forgive me, John, when I say this, but we would love the lead hazard control funds that are going out in grants throughout the country to communities to allow for at least fixture replacement as part of a housing, as part of the healthy homes piece in houses, and utilize the healthy homes money to start to address some issues in lead and water. That's a minor and small piece, but I do think we have to pay attention to the larger framework here.
Great. Thank you. And I'm being told that we have less than 5 minutes, so we have time for one last question. You're the lucky one.
I won't take
Great.
that much time. My name is Ed Graham. I'm from the National Low Income Housing Coalition. First, I want to endorse Ruth Ann's Ataturk provision. That's very good, 90 days for compliance. But what I'm really here to talk about is I'm a recovering CDBG geek. I did nothing but CDBG work for about 27 years. Got started in 1977 with the county, Scott County and Davenport, asking me how to help them get CDBG used for lead abatement. So on my way over, before coming over here, I looked at the CPD website and looked at how much money all of the entitlement jurisdictions were spending for lead paint reduction, and their report goes back to fiscal year 2001. But in fiscal year 15, which is the latest available, the least amount of money over that 15-year period was expended on this use. Only $7.4 million among all the entitlement jurisdictions. That's like, 1,200 entitlement jurisdictions. So just a reminder that that's another small resource. It's not adequate, but it's chipping away at, if you pardon the pun, at the problem. So I urge everybody to take a look at that potential resource and get active in your local communities to tap that to help with this problem. Thank you.
Thank you. Thank you. In response to that?
I think the general point is you're right. There are many other HUD programs and resources that can be brought to bear, and in fact, it's sort of we don't really do a very good job of counting how many, the number that was given earlier and the number of lead-safe units produced. Well, that was true for the lead grant program, but it probably didn't include all the other HUD programs, whether it's public housing or low-income housing or home repair programs and the like. So it would be good, I think, for the nation to realize the value of these other investments when it comes to helping make our housing stock safer. It's a great point.
Absolutely. Partnership and coordination of efforts, $1 here, $1 there, it starts adding up, and you put it all into one pool, and it'd definitely be a resource that's available. So I think what Dr. Breezy talked about earlier, going out and meeting the other partners in your communities, if you don't know the wastewater treatment people, as a housing authority executive director, go out, meet those people, and it works both ways. So building that relationship, those coordinated efforts are very important.
I think HUD's leadership on the true north here of primary prevention of, and I want to get back to Tom's point about this interagency collaboration and reinvesting time at the interagency work group on healthy housing, and having funding for HUD and other agencies to participate and drive those standards together so that we don't go from 2010 to 2012 and have the lag, but we have more immediate urgent implementation. Training and standards that are common are critical here. And, you know, earlier I just wanted to make a point, a really important point, about the opportunities we do have through your rule to do training and engagement and employment through the Tenants Council and residents who are in public housing to engage them in the work of lead poisoning prevention in this country. And this is an opportunity to reach out and reach the community that is in public housing and help to put a pathway that they can join with us and be part of the work that is needed. But I do hope that as a country overall, as we make larger investments, that the investments in lead poisoning prevention, the jobs around data collection, around assessment, around the contracting, and around the follow-up work on case management and advocacy, that we're investing in the communities that are most impacted and providing the workforce opportunities there.
I couldn't agree more with you, Ruth Ann. You know, as I mentioned during my opening remarks, it's going to require ongoing partnerships, but the involvement of residents will be very key. Because at the end of the day, you know, we're doing this to ensure that families and children are protected and are cared for and are able to lead a healthy life and reach their potential. So with that, I'd like to thank our panel members. Thank you for your thoughts, your insights, and helping to ensure healthy and safe homes. And I'd also like to remind you, please send your comments. The proposed rule is out through October the 31st. That's the last day for public comments. We want to hear from you. We want to continue strengthening the work that we're doing to ensure that we're providing healthy homes and healthy communities. And now it's my pleasure to turn it over to Michelle Miller, who's going to continue our program. Thank you.
Thank you, Lourdes, and thank you to the panel and to all of you for the great questions and discussion and comments that you had. We really appreciate that. The next part of this afternoon is going to be going into the breakout sessions. There will be 3 concurrent breakout sessions that will take place until 3:15. We will be in just behind us, and then in room C, that's behind a little further, and then also in room 8236, which is our office, and you'll be escorted up there. We will be providing a facilitator in each of the rooms that will help get things started and keep things on track. We also have a note taker that will be in each room keeping track of comments and suggestions and things that people have to say. They will not be keeping track of who says them, so just keep that in mind. We won't be, giving anybody bad stickers later or anything like that. So you are free to choose which session you would like to participate in. The 3 sessions are as follows. Health and housing collaboration. This one will focus on how to enhance communication between health and housing programs and on what lessons have been learned about the lead safe housing rule, program implementation, and the EBL responses so far. This session will be held in Auditorium B, which is just right behind that little deal right there. The second session will focus on ensuring compliance. For this, we want to hear about approaches to helping housing providers comply with the rule and the proposed amendments, and also on effective approaches to enforcing the rule. This session will be held in Auditorium C, which if you go out the door, take a right, it'll be right around the corner there. The third session is on non-governmental resources. We are interested in insights into how philanthropic and other non-governmental organizations can mobilize resources for compliance with the rule. The session will be held in our office, again in room 8236. You'll go out the door to the left again to the elevators and up to the 8th floor. And we will have staff that are helping direct folks up there, so you shouldn't get too lost. If you're getting lost on purpose, then people will also find you and bring you back. At 3:15, you'll come back in here. We'll ask that you wrap up your breakup sessions, come back to this room. While you're in your breakout session, if you could make sure that you choose who the person will be to report out on what your group has talked about. So if you could make sure to do that for each of the sessions as well. You'll complete your preparations for having your representative report on findings and recommendations. And your report should be about 7 to 8 minutes, or no more than 7 to 8 minutes. And you will see a sign outside of this room pointing you to the breakout session location. But again, the health and housing collaboration is right back here. Ensuring compliance is out the door to the right. And non-governmental resources is in 8236. All right, thank you. Welcome back, everyone, to the Lead Safe Housing Rule convening. As I had mentioned earlier, we're going to hear from each of the three groups, the representative from each group, and we're going to start with the Health and Housing Collaboration Session representative, Peter Ashley from the Office of Lead Hazard Control and Healthy Homes.
Thanks very much. Thanks for hanging in and being here still. I couldn't strong arm anybody in my group to report out, so here I am. So health and housing collaboration, we had a good discussion, pretty lively. One of the earlier points is the importance of bringing Medicaid into the mix to support home assessments, especially in high-risk housing to identify lead hazards. Also mentioned is the need to improve screening among Medicaid-eligible children. So that was, and there was the point was made that there are some case studies on this on the website of the National Center for Healthy Housing. Another point made was that we can use the Affordable Care Act to help with this coordination between housing and health organizations. There are provisions in the Act, such as the medical home requirements and accountable care organizations that help bring different sectors of the community together, and that can be used to spur this communication and coordination between housing and health agencies. Another point, a related point, was that community health workers are a valuable workforce for conducting home assessments and outreach to families, high-risk families. And again, the point here being that, and this is in place now in a number of locations around the country, a number of states, that they need to be covered, the cost of using community health workers by the healthcare sector, by Medicaid, by managed care organizations. The value of doing that was pointed out. Another emphasis was that pediatricians have to play a key role, that they need to be notified when there's an EBL child so they can reach out to the family, provide education, and follow the care of the child. So they definitely need to be in the loop. We talked quite a bit about lead in drinking water. The point was made that currently, if a utility if the testing shows that they're exceeding lead levels in the sample, if they're above the screen, that the utility has a list of organizations they are supposed to notify, including the health department. But the point was also made that this hasn't been a very effective process, that it seems like the word isn't getting down to the individual families. And so we need to look at how that system can be improved. And the point being that some areas don't have local health departments, and that we really need to look at how maybe HUD could be brought into that more, and how this chain of communication can be improved so that results in more action at the individual home level. Also, there was a plea at the end for more institutionalized data sharing networks, at the federal level and at the local level. Now it's sporadic, it's inconsistent, and we need more. The word was institutionalized systems. Not an easy thing to do, but it could be very useful in the sharing of information on EBLs with the housing sector. So those are the notes I had. If anybody in the group has something they really thought I missed and you want to point it out, please jump up and wave your hands and come up to the mic. Is that fair? Oh. Anybody? Okay. Thanks very much.
Next, we'll hear from the Ensuring Compliance Group. Tom Neltner is the representative from their group.
Thanks, Michelle. So I drew short straw and get to write this up, and I'm not a houser by training, so I'll use words that I don't quite understand. So I'm giving a summary of what the overriding message was, that HUD needs to look at the housing authorities and all of their responsibilities and how this fits into it. That there's an AFFH, affirmatively furthering fair housing. That's a new responsibility that went on the housing authorities, and the lead rule needs to be in context of that. There needs to be a recognition of the rest that's going on. The other one is the smoke-free public housing. Now, I like both of those, but we need to recognize that there's a lot already going on, and don't just do this in a silo or in isolation is one of the messages. The second message was that in that context, there's proration of administrative fees and a backlog of capital needs. Now, I think that that's not good for the Public Housing Authority, and as long as that's happening, it's hard to set high expectations for what they can do quickly. The third one was that, and this is sort of picking up that same theme, that assisting with compliance and not just using withdrawing funds, not the threat of withdrawing funds. Now, I can say that there were others in the group that thought that withdrawing funds was important to get people in compliance, so it cuts both ways. One of the overriding ones was that we look back to what happened on the lead-safe housing rule back around 2000. I heard it started in 1996 on getting the education done. 2000 was when the first of the compliance deadlines went in. That's a good example of how that outreach works. And while this is not as big as that, there are some real examples there of how to do it to HUD that it should look at. Next one is that we had a gentleman from DC Housing who was saying that with respect to lead, that they have a rule in DC that says not just DC housing, but any rental housing, you need to do a dust wipe test before you go in. And what happened is, I know this is fine to show, all of a sudden, they didn't get lead-poisoned kids coming in. The numbers of EBL referrals that they got on Housing Choice Voucher dropped to, I think the gentleman said there was like 1. Sounds like prevention makes a difference. And isn't it better to not have it drop down to 1 so you're not doing that follow-up? So what we also suggested as a group, that this may be a good case for HUD to do a case study and look at that to see what really works and what is more effective. And I personally am betting that once the landlords know, the Housing Choice Voucher landlords know that they're going to be judged, they're going to start doing better. So you're just going to have a higher pass rate. Another one is, let's see, that checking for RRP compliance. You're probably not sure where that one came from, right? And that is, when you're looking at compliance with this rule, ask whether they are using certified contractors. Do they have are they a certified renovation firm if they're using their own people? That basic cross-check, because it's another federal agency that needs the help. And frankly, what one of the messages was, don't wait for an Office of Inspector General report to come in and say, wow, HUD, you were totally missing it. How could you not have known this? Or why wait for a gotcha report coming out in the media on a public housing authority that just forgot about the lead-safe certified renovation firm and could have done it had HUD been reminding it. So having emphasis on assistance, using some of the examples in the past, and recognizing all the challenges that the PHAs already have, and putting it in that context. Anything else from the group? Okay, thanks.
Thanks, Tom. And we'll hear last from Neil from the Cleveland Foundation for the Non-Governmental Resources Group.
Thank you, Michelle. Tom, you drew the short straw. They asked a person who's from the city of champions and soon-to-be baseball champions to address the crowd. So go Cavs and let's make it happen, Indians. All right, had to get that plug in. So in our group, it was a small but powerful group. We talked about how the non-private sector can support this health initiative led. And standards will drive the private sector. We want to do something different. So how do you, it's not on the government, nor should it be, to address these health issues, these health disparities that we are having, such as lead. And so we looked at what we're doing in Cleveland. And I mentioned earlier, before we broke out into our sessions, that the initiative that I managed along with my colleague, Jackie Matlew from Case Western Reserve University, this initiative is anchored by Case, Cleveland Clinic, and University Hospitals, and it's funded by the Cleveland Foundation. And the Cleveland Foundation only agreed to fund the initiative if the two competing hospitals, if you will, decided to work together. And so that's what's happening. So at our table is a bevy, and the table being a community health action team, which consists of two different teams. We call them CHATS, there's an acronym for everything, where we look at lead and infant mortality. On the lead is the County Board of Health, it's the Museum of Natural History, it's the Cleveland Clinic. Residents, of course, sit at the table. So with the foundation playing a part, we said, well, there's a slew of foundations, Ford, Rockefeller, Kresge, Robert Wood Johnson Foundation. Why can't they do the same? And so instead of also not just looking at the foundations, but also looking at the spin down foundations, creating something as opposed to rewarding grants, put your money where your mouth is and spend on something that will benefit a community. We also talked about, I got to flip here to make sure I'm on the right, we talked about the social impact bonds. That's imperative to where we think we should go. In this work, you have to make it sexy. That's the word I use. You have to make it sexy. It can't be boring. It has to be innovative because it took years to create the monster. It's going to take years to slay it. One of the things we also talked about, too, is the importance of involving the arts community. I think the data shows how that can be impactful, arts and culture. You have to infuse that in the work that we're doing. It's heavy work, it's a heavy load, but you have to infuse it. And I think the arts, which could be the Museum of Natural History, the Museum of Art, Institute of Art, you have to have those players. We believe, and we talked about the institutions serving the communities in which they stand. So in most of the work that we're doing, we know that the communities are there. And not just the institutions that we think, but there are community institutions, your corner stores, the pubs and bars where parents hang out at, the grocery store. You have to be very innovative in asking the private sector to support work that's going to benefit the community. I think that is it for our report. But you have to, oh, and lastly, certainly the wealth of young people. Some of us are getting older now. The autumn years are fast approaching. So you have to look at how they think and what they're doing to impact this heavy load that we're dealing with. So I thank you. Go Cavs. Let's make it happen, Indians. Thank you.
Thank you, Neil, and thank you to all the groups and to the folks that participated in those groups. We do have a little bit of time before the secretary comes out, so I want to open it up to folks. If you have any questions for the three work groups, I guess. Any questions that you have for the work group, if you could just let us know which group you'd like to ask the question to, and then we can answer those. Any questions for the groups? Tom, Neil, or Pete, do you have anything else that you'd like to add? Anybody else have anything they'd like to add? Real quickly. Oh. Go ahead, Pete.
I was just looking to see if Pat Bricey was still here. Pat was noting CDC does have a environmental health surveillance program, and the question was, do we have a list of the highest risk communities in the U.S.? And Pat mentioned they're going to be working on that smaller scale level of resolution, so we'll be able to do a better job identifying those higher risk communities nationwide. So just wanted to mention that.
Thank you. Thanks for helping stall too, Peter. It looks like we're good to go, so I'd like to welcome John back. Thank you.
Well, listen, thanks a lot for all of your input, and I look forward to looking at all of your suggestions and recommendations. But on a more important note at this stage of the game, thank you, Michelle. I know you've been involved in the breakout sessions, and everyone has participated, so we'll be able to pull that together. But our convening, or our next segment, will provide insights from a unique position, and that's the very top. Secretary Julian Castro is fully committed to our mission to eliminate lead poisoning in children and has supported this convening since it was first conceived. We're delighted that he has agreed to come down and speak with us. As many of you know, the Secretary was sworn in about 2 years ago, and there are many issues that he's been involved in, including making homeownership more affordable for responsible families, affirmatively furthering fair housing, eliminating homelessness, working with the private sector to help children in public and assisted housing access the internet, promoting sustainable communities, and using housing as a platform to improve health. This Tuesday, it was announced that Secretary Castro will lead the U.S. delegation to the United Nations Conference on Housing and Sustainable Urban Development in Quito, Ecuador, where I used to teach way back when. In that role, he will help the conference renew the international commitment to sustain urban development, address poverty, and identify emerging global challenges. Two related issues that he has kept high on his agenda are reinvigorating the department's focus on healthy homes and health in general. He has dedicated a substantial amount of time and effort to both highlighting the good work that HUD does as well as those of our partners and our grantees on this issue. He has been a champion for our office, and I appreciate that very, very much. And all of you should know that as mayor of San Antonio, they had a grant, and they were one of our better performing grants, so he knows firsthand the good work that our grantees do each and every day. In particular, he has supported the development of the proposed amendment to the lead-safe housing rule. As with any rulemaking, many people and many offices and many constituencies have been involved, and the Secretary has encouraged and facilitated that collaboration. It's my honor to present to you Julian Castro, our Secretary of Housing and Urban Development.
Thanks, John. Thanks a lot. Yeah. Good afternoon. Well, it is so great to join you all here. Let me just begin by saying that I think this afternoon that our thoughts and our prayers are with the folks of Florida and the Carolinas on the East Coast who are preparing for Hurricane Matthew. I know folks come from all over the United States, and some of y'all may have family down there, so they're in our thoughts today. Thank you, John, for the introduction, but more importantly, thank you for your great leadership and the work that you and the team are doing to ensure that every child is able to live in a healthy home. John and the entire team in the Office of Lead Hazard Control and Healthy Homes have done a fantastic job coordinating today's event. Let's give them a round of applause for that as well. I also want to give a big thank you to all of the partners and the experts who have so generously shared their insight with us today. We appreciate it, we value it, and thanks to each and every one of you for being here as well. HUD could not do what we do without your partnership. We're in this room today because the science is very clear that any amount of lead in a child's blood can rob that child of a healthy future. So lead has no place in our homes, in our schools, or in the soil where our children play. We also know that exposure to lead is entirely preventable. So we have to do more to protect children and their families. I want you to know that HUD remains fully committed to making lead poisoning a health crisis of the past. And I can sum up our work to keep children and families safe from lead in 3 words: leadership, opportunity, and partnership. First, HUD will continue to be a national leader in the effort to protect families from lead and other housing-related health hazards. In fact, this month marks 25 years since the creation of our Office of Lead Hazard Control and Healthy Homes. And y'all look good for being a quarter of a century old. But in that time, in those 25 years, through grants alone, Healthy Homes has helped nearly 200,000 families across 45 states protect themselves from health risks. And we've used our enforcement powers to remove lead from another 180,000 homes. That's been good for American families. And the fact is that we need to keep working. And that's why we're renewing our focus on advocacy, so that more folks may be at risk, who may be at risk, know that they are at risk, and know where to go for help when they do find themselves at risk. Our lead-safe homes, lead-free kids toolkit is a central part of that effort. And it has 4 basic goals: improving HUD's process for identifying lead hazards, strengthening partnerships with other agencies and with the private sector to better protect Americans from household health risks, providing more resources for Americans so that they're able to identify risks and get them addressed, and establishing a framework for assessing how effective our efforts are so that we can do more of what works and eliminate what doesn't work. I'm pleased that we're already making progress to meet all of those aims. For example, we're working with HUD grantees and other partners to deploy mobile testing units in a number of communities, so we'll better identify children who have been exposed to lead and get them the care that they need more quickly. As you know, a joint CDC-HUD study published in the American Journal of Public Health last month showed that children living in federally assisted housing have about 20% lower blood lead levels on average than similar children in low-income families living in homes where there is no federal assistance. That means hundreds of thousands of children are more likely to succeed in life because they won't suffer from the debilitating effects of lead exposure. We want every child to have that same healthy start. Every child in our nation deserves a safe and healthy place to live, no matter how much money their parents earn or the neighborhood that they grow up in. The second word I mentioned was opportunity, because at HUD, we believe that a home should be a foundation for greater opportunity for every American. And that's been President Obama's belief from the start. The president has said that in our country, a zip code should only matter for getting your mail and never for determining how far you can go in life. And HUD's place-based initiatives are helping to move our nation closer to fulfilling that basic promise. Millions of Americans don't have the money to remediate health risks on their own, and moving their kids to another neighborhood often is not an option. So HUD is investing in low and moderate income communities so that the citizens who live there aren't left out or left behind. And I want to reiterate a point I know you've heard throughout the day, which is that we're counting on every public housing authority to help us in this effort. So make sure that you have a strong team in place to complete your lead-safe certifications if you haven't done that already. A home can't be a springboard for opportunity if it makes you sick or robs your children of their ability to thrive. And I want you to know that now and in the days to come, we're going to put everything we've got into addressing this health crisis head on. And finally, partnerships. Collaboration will remain central to supporting the communities grappling with this health crisis. We rely on partnership with our grantees to educate the public, to remediate home hazards, and protect the families that need it most. Just this morning, one of those grantees, the Washington, D.C. Department of Housing and Community Development, hosted a bilingual education and blood testing event at Mary's Center Daycare in Northeast D.C. to spotlight Children's Health Month. The sooner we identify children who are exposed, the more that we can do to help. And that's why we'll also keep partnering with other federal agencies and with local governments to better address lead hazards in places like Flint, Michigan, or East Chicago, Indiana. HUD may not regulate the water flowing through the pipes in Flint's public housing or the lead emissions from a factory in East Chicago, but even in a supporting role for our partner agencies. Our expertise and our initiatives can help make communities safer and promote more positive change. Frankly, as the folks in this room know, we also need more federal resources to fully meet the challenge of making lead a hazard of the past. I'm glad that some members of Congress have proposed new legislation and new funding. That makes sense, because the investments we make in prevention and remediation more than pay for themselves in the long run. A big thank you to all of our philanthropic partners who are here and who are listening, especially those who are in the room today. You get it, and you've stepped up to reach families who need help, but who oftentimes we just couldn't reach without additional resources. I particularly want to recognize our partners at the National League of Cities. Together, we'll soon kick off an effort to train local leaders on how to address lead hazards in their communities. Because the bottom line is that we know we can't do this work by ourselves. And you're our experts on health, on civil rights, on the environment, on legislation, and on the communities that we serve. The feedback you've provided today will help us to implement a strong new rule that'll help save lives for years to come. So again, thank you for that, for joining us today, for being such responsive partners, and most of all, for working to protect the health of our nation's greatest resource, our children. We're truly grateful for your engagement. October, as you all know, is Children's Health Month. And while just about everything that we do here at HUD, in one way or another, benefits the young people of our nation, the work of our Healthy Homes office touches young lives in a very special way. I think of the work we do together to make home the place where opportunity starts, and it makes me think of my own children, Karina and Christian. As a parent, you dream of all of the things that your children will accomplish, you hope that they'll accomplish, and their future successes. But so many children in our nation today won't have that healthy start without your work, without your dedication and efforts. So there's one more thing we need you to do. Please visit regulations.gov and share your insight on our proposed rule. Get the folks you work with in community groups, philanthropies, or in the private sector to visit the website and to share their feedback as well. Help make sure we've got all the information and ideas we need to get this rule across the finish line. Together, we can and we will get this done. And it'll bring us one step closer to making home a source of health and opportunity for everyone in our nation. Thank you all very much. Thank you so much for being here. I appreciate it. Thank you, John. Thank you all. Thank you.
Thank you very, very much, Secretary Castro. Well, I know that you all have been talking about a variety of different things, and we've come to the witching hour now. I want to wish all of you safe travels, and that's especially true for those getting on the Metro. I had a chance to listen to some of the comments earlier. I would love to go through them. You know, Tom, your insights, and Ruth Ann and Dave, Georgie, I want to thank you so much, and especially our federal partners, Pat and Keisha, for coming and participating with us. Anytime you have an opportunity to kind of bring this group together, you get a lot of great suggestions. I did want to at least alert everybody to one thing. There was a lot of comment about what our strategy ought to look like going forward. And I want to energize all of you here to help us over the next 100 days, and especially going into the transition. We're taking a look right now under the auspices of the Presidential Task Force on Environmental Health Risks to Children on what that new strategy ought to look like. Dave was so instrumental, Warren, Peter, and others in developing the first one. There were a lot of assumptions made. A lot of it had to do with funding. A lot of it had to do with the science at the time. But now we're going back, and Warren and Peter have been charged with working extra hard on updating that strategy. It's going to be one of the agenda items on the President's Task Force agenda for the October 19th, where we're going to at least outline what some of the challenges are, what some of the things we agree on, and where the gaps are. And I know that Pat, on behalf of CDC, is very anxious to be part of that discussion. Keisha from EPA will be part of that discussion, on Ruth. And what I'm suggesting is, what I'd like to do is to take a look at that, and that we're not going to be able to get it through, right, in the next 100 days. But we can have the framework ready to go so that whoever comes in next understands the importance of this issue, and with some of our partners, they can carry the message to the Hill and help us frame it, if you will, so that we're getting the very best audience going forward. So you've got my commitment on that. It is on the agenda. We will take all of your comments on that. That's on a side issue on the lead-safe housing rule. We do plan to turn that around as quickly as we can. Lourdes, who you met earlier, will probably be one of those that will be pushing so hard to get the comments turned around, and hopefully we can get it signed before this administration changes. That's our goal. Wish us luck. Thank you very, very much for everything, and I wish you all Godspeed. Thank you.